ready to go. It's for this patient. It's got their patient stickers on it, but yeah. Something we're going to talk about too, and I'm glad y'all are covering it, is with certain trach tubes, and you're going to see this a lot in kids. They will have a custom trach made for that child, because it may be that the child has a longer airway than normal or a shorter airway, and maybe the standard trach tube doesn't reach far enough, or it's rubbing on their carina. If we have a custom trach made for them, they make two. One to be in and one to be clean. Don't throw it away. Clean it. And then you put it in a sterile baggie or a little specimen cup, and that is that child's spare trach.
We gotta know that it's a custom trach? What is, I mean, like, it's
It
gonna
should be,
marked on there? No.
but it should be passed on in report. It should be documented in the patient's chart that the size is a like, so you may get in report, oh, this patient has a 4.5 P duplex Bavona custom trach. That should tell you, don't throw it away. Okay? And that's your job, to report that to the next person, so they don't throw it away, because those trachs are expensive, especially custom ones. And it's not like you can just call Walmart and be like, I need another custom one. It might take weeks to get it in. Okay, so the point is, you cannot bag or connect a vent circuit to this. So if the patient does have to be bagged or be on the ventilator, you've got to have another cuff or another intercannula ready to go. If it's disposable, that's easy. If it's not disposable, you need to have a spare that you have clean and ready to go. Throw it in there, you clean the one you took out, and then you put it in a baggie and have it ready for the next person's trach care. Okay, what if the patient's just a spontaneously breathing patient and they're maybe not even on oxygen? Well, then they're okay. They can still breathe through the trach tube. If they're on oxygen, maybe through just a trach mask, you can still put the trach mask right here. You don't have to do anything special while you clean the intercannula. Are we okay with that? All right. So once we go through our trach care procedure, we're going to look at some other trachs just so y'all can see what some other ones look like. Okay. So let's say we're doing our trach care procedure. We'll pretend that that's all hooked up. So I come in and I want to get my patient started. So the first thing I got to get is all my supplies. Most hospitals are not going to have this. So put your big girl panties on and get over it. You got to make your own. But we do have these. These are Trach Care kits or Trach Care trays. Okay, so you're going to open it up. And what's the first thing you see on top?
Your sterile gloves.
Your sterile gloves. Good. All right. So you're going to go ahead and put your sterile gloves on. All right. Because in the book world, we have to be sterile. Oh,
Nice small.
I think I had them backwards. I think I was trying to put the thumb in the pinky. Okay. So you got your first one on. Remember, everything in there at this point is sterile. Same thing, I'm putting them on the wrong way. Okay, so I got my sterile gloves on. Everything's good. Next thing you see first is your little work area. Okay? So you would open that up. Still sterile. Okay? Don't feel the need to be all touching it. You could, because in theory your hands are still sterile, but don't touch it if you don't have to. The next thing you're going to do is dump all your supplies out. Okay? Now this tray I can put down here. I don't have to have that on the sterile field. Dump it. Okay. So you see now I've got 3 fancy little bins, basins. So what am I going to do? Good. Sterile water, hydrogen peroxide, and a mixture. Okay? The mixture goes in here because that's where your intercannula goes.
Okay.
The peroxide and the sterile water go into here. Whichever one you want to put in whichever one, I don't care. It doesn't matter. I think they just make one smaller than the other, so it's easier for you to go, the peroxide's in the small one, the sterile water's in the big one, so you don't get confused. But you put pure peroxide in one, pure sterile water in the other, and a mix in the two. Peroxide has to be opened within the last 24 hours. Generally, sterile water is the same thing. So anytime you open a bottle of sterile water or peroxide, you are supposed to label it with the date, the time, and your initials. Are we
But you're
okay with
opening
that?
that before you even get all of this stuff, right?
And that's good to know. If you don't, that's a good point. If you don't have an assistant, that's kind of stuff you want to be getting together, because in the end, you're going to be just like suctioning, where you've got your clean hand and your dirty hand.
Right.
So you would, at this point in time, if you were by yourself, take your dirty hand, fill everything up. But you do have to maintain at least one sterile hand. Are we good? So we've got all that set up. I'm going to go through what all this paraphernalia is. So at this point in time, I would want to unsecure my trach ties, right? Get that, I guess I'll say toss it in the trash. If your patient is going to be a cougher, then you need to hold the trach tube with your dirty hand. If they're not going to be a cougher, then let them be, or hopefully you have an assistant to help you. So I'm going to let Chatty be my assistant. Your job is just hold. You've got fancy gloves on. They're not sterile. She does not have to be sterile. Gloved, but not sterile. Okay, so I'm ready. Okay, so first thing I'm going to do is remove my inner cannula. We're going to pretend that this is a non-disposable for learning's sake. This is going to go in the mix.
Oh, it goes in the mix first.
To start soaking. Are we good? So that goes in the mix. So my patient hopefully is breathing on his own. He's happy. He's probably talking to her, telling her about her finger that's sliced off. So what's the first thing I'm going to do? First thing I'm going to do is start going through all of this mess. So you notice I got a whole bunch of gauze. What's different about this gauze? That's the drain sponge. That's the pre-cut. So that I'm saving for last. So I've got a couple of 4x4 gauzes. This is my replacement trach tie. We don't ever use that. You can throw that shit away. Okay? Some tweezers if you needed help getting stuff through. Most people don't use that. We'll put that to the side. So what do I actually use? These gauzes, my cotton-tipped applicators, aka Q-tips. This is pipe cleaner. I'll go through that. And of course, your bottle brush. Okay. So my first step that I want to go ahead and do is start cleaning up the patient. So I'm going to take my 4x4 gauze. If I drop it on the ground, I don't use it. Okay. So I'm going to take a piece of my 4x4 and I'm first going to go into my peroxide. Let it soak. Wring it out really good because you don't want to be dripping peroxide all over the patient's skin. Remember, peroxide is an irritant. Okay. So now I am going to clean around the stoma site. So I'm going to start at the stoma and wipe away, trying to use a different section of my gauze each time so that I'm not using that same dirty piece and wiping around. Does that make sense?
And you getting under here?
You can kind of get under it. You don't have to get too far under it.
Ours, that we cleaned it, it actually bent.
When did
And
you do
she
Trach Care?
pulled it back. She pulled it back.
When
No,
you did-
at Children's.
Okay.
We've seen it done like a bunch of times. She pulled it back to get all the way to
Like
dent
this.
underneath. Yeah.
And that's
She
fine.
was like, pull it out, pull
That's
it out.
fine.
Ooh, okay. She
But
did
the point
care
is,
thing and
you're
we held it.
cleaning
We held it for her.
away. And you're trying to use a different piece of the gauze. Are we good with that? So I'm done with this guy. I'm throwing him away. Anytime you wipe with peroxide, you are always going to follow with sterile water. It's an irritant. You want to get that off the patient's skin. Soak another gauze in sterile water. Wring it out really good. Same thing. Following where you just went. Trying to use a different piece of the gauze. Cleaning in to out. Is everybody okay so far? Done with that guy. Here's an extra one because you're going to have some funky monkey patients that you're going to need more gauze than just one. Now that I did that, now I'm going to come with my Q-tip, peroxide it, and then this is where you can do your fine cleaning. So if you really need to get up under the flange, okay, if you got some real gross crust around the stoma site, follow that with what? Sterile water. So get all up under the flange, clean around the stoma. What's next? Why do I need all this crap?
You gotta clean the inner cannula.
Okay, so the pipe cleaners. Most people don't even worry about this, but you could use this as a scrubby brush if you needed one. The thing with pipe cleaners, as most of y'all know, is they have a little wire that can hurt. So if you use the pipe cleaner, we always kind of bend it and make a little brush, okay? So you could go sterile water. Some patients are gonna have blood, secretions, all kind of stuff on the flange. So you could use that to actually scrub your flange. Same deal. I usually come behind it with some sterile water and just clean it up real good. You don't have to do that. You could also use a Q-tip. But if your mama has a big bloody gross flange, you're gonna want somebody to clean that, right?
Yes.
Okay. So now you've got your stoma, your flange, all of that clean. Your cannula's been soaking all that time. So now I'm ready to clean my inner cannula. I'll pick it up. Now I've got my bottle brush, shoving my bottle brush in there, all the way, getting any of the goo out of there. Okay. Now I'm going to dip it in the sterile water, rinse it real good, get all the peroxide off of it, kind of fling it, right, to get all the extra water out. And now I can replace my inner cannula. So we clean the stoma, we clean the flange, we got all underneath it, we've got a clean inner cannula. What's my next steps? Doesn't matter which way you do it. You can either put the drain sponge first, then the ties, or you can do the ties, then the drain sponge. I don't care. But let's say we're gonna go ahead and put our drain sponge. Sometimes it's easier to do it before the ties are on. So the drain sponge fits right up underneath it like that. Nice and pretty. This is a brand new pack of trach ties, okay? So now I'm going to put my trach tie through. So this would be where some people do use the Q-tips, whatever, not tweezers. You don't have to though. Okay, and then I'm coming around. And put my other side through. Okay, so you notice
Too tight.
I made him too tight. Remember I re-secured it? So I need a little extra. So I'm going to go ahead and secure it on this side. My assistant Chatty is still holding, right? All right, and then I can re-secure it this way. Okay, so I want to make sure that I can fit 2 fingers underneath it. Okay, you don't want to have it so tight to where you're choking the patient, but you also don't want to have it so loose that one good cough and the trach is out. Because one good cough and the trach is out. So that's why you want, and it's not 2 fingers on each side, it's 2 fingers total. 2 fingers total, that's it. So right now you would definitely say that's way too loose. I can fit almost my whole hand. All right, so you would want to go a little bit tighter. Are we okay with that? At this point, you would want to reconnect your patient to whatever device they were on,
If they will.
oxygen, whatever. Generally, something else, and I kind of skipped it, before you start your trach care, it's always a good idea to maybe suction the patient, because that way you've kind of gotten any secretions that are in the pipeline out of there, because there's nothing like when you've just put this nice fresh drain sponge on and they cough a big loogie onto it. Okay, so suction them before. So we understand the pre-cut. If you don't have the pre-cut,
How long does that stay on?
you should change it every trach care. If it gets soiled and wet and gross, change it more often. If you don't have a pre-cut one like that, don't try to make one with this gauze, because this ravels, and then you'll have little strands of thread that get into the patient's stoma. So if you do not have a pre-cut, you make your own. You're simply going to just fold a 4x4. We'll pretend like this one's brand new and
And
clean,
fold another one.
and then put one on the other side.
So I won't cut it, okay, all right.
And you've made your own drain sponge, a cheaper one. Are we okay with that?
Yep.
Okay, so to go back through the steps again. Oh, these gloves are